When patients come in for us to evaluate their facial aging, there are several things that we take into consideration. What I usually tell patients is the face is very unique because it's the only place where muscles actually start on bone and go to skin. Everywhere else in your body, your muscles go bone to bone. And so as we age, we start to predictably lose fat. We predictably lose it through here, we predictably lose it underneath the eye, and there's a couple of different things approach-wise to which we look at facial aging. One of the things that we look at is if we can simply replace the volume with fillers and or Botox to kind of reduce the amount of fat loss. When patients start to have flatness through here, adding volume back to their face and a very natural appearance is one of the things that patients get great benefit from. It's a simple procedure that takes about 20 to 30 minutes to do, and typically the injections last about a year to a year and a half. Certainly with any type of facial aging, coming in and having us look at you and kind of determining a treatment plan for you would be the best. When we see patients for facial aging, some patients are candidate for fillers. Some patients are more candidate for surgical procedures that over the long term would actually benefit them more specifically for long-term use of facial aging and correction of facial aging. When I look at anybody that has any type of facial aging, what I tell them is when we do any type of facelift or neck lift procedure, we're not pulling on skin. Mainly people that have pulled skin look like they have pulled skin or look like they stepped in a wind tunnel. When we're actually doing a facelift procedure, what we're doing is we're moving the muscles back to where they used to be. When people do this in the mirror, they're actually moving those muscles back to where they used to be, and the skin naturally follows. Patients always ask me whether or not I can tell if somebody's had a facelift. Well, you can tell if someone's had a bad facelift because most people, you want them to be natural. You want them to look more refreshed. You don't want them to look pulled and tight and unnatural. When we examine somebody for facial aging, everybody's face ages differently. Certainly the top of the face, the middle of the face, and the lower face all age differently and all can have treatment plans associated with them. A lot of patients just don't like the area around their eyes and they have fat below their eyelids with the bags underneath, or they have excessive skin, and that's what bothers them. Typically, a lot of times those are best treated by performing an upper eyelid lift or a lower eyelid lift to help smooth the junction. What I tell patients is when you look at somebody in the grocery store and you actually look at their age, what you're really doing is you're adding up the hills, the valleys, the crests, the spots across all of their face. One of the signs of youth is when their lower eyelid, their cheekbone are all one flowing unit. You look at a magazine, you look at the cover of any type of magazine that they have, and there's always going to be somebody on the front that there's no break between their lower eyelid and their cheekbone. It's one flowing unit. And when we look at any type of facial aging, what we're trying to do is we're trying to help contour either through lower eyelid lifts, upper eyelid lifts, or blend that with facelifting to make sure that we can achieve their youthful appearance.